Today we have a really special guest, a famous scientific, one of the best known and recognized veterinarians in the world. Our friend, Dr. Joaquim Segalés. Welcome, Kim.
Hello, Alex. How are you doing?
Hi. Thank you for accepting our invitation to be here.
No, my real pleasure. It's really great to be here.
Okay, Kim, first of all, tell us for our audience, who are you if there is anyone still that doesn't know who you are?
No, I'm pretty sure that there's plenty of people that doesn't know me. But anyway, no, my name is Joaquim Segalés. I'm a professor at the Autonomous University of Barcelona. In fact, my major topics in teaching there is basically pathology. However, I have been involved with the swine clinics for a long period of time already. And I have some part of research which is ascribed to a special research center called IRTA-CReSA.
Well, I know you're being very close and humble, but I must say, I will take a rabbit out of the hat because I know you are one of the leading specialists in the world in swine diseases, which is really a successful career, which, it's very impressive. So tell us a little bit the story. How do you get into veterinary science? Was it love at first sight? What was your motivation, your inner call?
Well, I must confess it's not very special because I must, for example, in my particular case, I'm a son of a farmer, so we had pigs at home since I was a very young kid, and I was always, let's say, attracted by the different animal species because we have some hens, some pigs, the dog, etc., and I like it. But it was exactly when I was at high school that I had to decide what to do in the future. And I had three major options, which was biology, veterinary science, and medical science. However, the medical science was not so attractive to me because I thought, damn, I have to deal with people all the time, etc. People are not easy to deal with, so then might be the veterinary science would be better than biology because biology is a very broad spectrum but not very specific. So at the very end it was not a love at the first sight, so it was a kind of, let's say, internal discussion until I reached the point of I want to be a veterinarian.
So you learned to love it with time.
Yep,
and
absolutely.
that took you to where you are right now. Excellent. So you referred IRTA and CReSA. So can you tell us a little bit more of what you do there?
Sure. In fact, IRTA-CReSA, IRTA is, let's say, a bigger institute of research, which is basically related at the Catalan government. However, there are different institutions within IRTA. One of them is the Animal Health Research Program, and the Animal Health Research Program is CReSA. In fact, CReSA stands for Research Center for Animal Health. And I have been ascribed to this center for, well, 23 years already, and we are doing research of different types, in my particular case, basically focused on swine diseases. However, in 2014, it was a kind of change in my life in the sense that we started working with zoonotic coronaviruses. It's amazing, but my first, let's say, touch with the zoonotic coronavirus was MERS coronavirus. And MERS coronavirus, it's a typical virus affected the Middle East, and the intermediate host are the dromedary camels. So we did a little experiment with dromedary camels at that time. So anyway, I discovered that to work with other species than swine was interesting. However, if you want to try to work with dromedary camels, don't try at home. It's really, really complicated. But it was a really, really nice starting. And then it was relatively easy by 2020 with the pandemic of the COVID-19 to jump into the SARS-CoV-2 because MERS coronavirus and SARS-CoV-2 are from the same group of viruses.
Excellent. And another virus that I know you're very familiar with, and I think we all remember the first days where an unknown virus called Porcine Circovirus, a pathogen that was devastating for the industry, and it's now controlled, appeared. So, what can you tell us about this virus evolution? And I remember personally to hear you at the Morandom Institute some time ago, where you talked about Porcine Circovirus 2 and then 3, and what the industry could expect. I mean, what you could tell us right now, what's in your head about this particular virus?
Well, in fact, it has been a long travel since 1997. We started working with this virus 26 years ago, and at the very end is what you said. It was a really devastating disease at that time. And of course, the lack of a particular vaccine prompted the veterinarians to try to counteract the problems in many ways, especially zootechnical measures or controlling other co-infections, etc. But it was really, really difficult, and they had to struggle with huge mortality, some cases in farms. And certainly in 2006, 2007, with the advent of the vaccines, the landscape changed completely, in the sense that suddenly that devastating disease was able to be controlled by means of one of those products. And I believe that since then the things have changed so much, in the sense that virtually the infection by porcine circovirus 2 is controlled. It's true, however, that might be there's still room for improvement, not only in the development of vaccines, but also in how to apply the vaccines and get the most from them when you apply in underfield conditions. And amazingly, of course, if you are working with PCV2, then in 2015-16 appears PCV3. Nowadays, we are much more convinced that PCV3 is able to cause disease in pigs as well. However, we do not know which is the extent of such a problem. And recently, 4 years ago, it was described PCV4. So this means that might be the field of PCVs is not yet stopped. So might be we can expect more PCVs in the future.
And you just actually jump, I can see you must have been a very good student at the time, because you automatically answered my next question, was going to be, with regards to the new PCVs, do we think we should be really worried about, this new circovirus, or is just this a pathogen with a low incidence?
Well, regarding PCV4, we must confess that we do not know almost anything. We know that it has been detected in some cases of disease, but it has been detected also in absolutely healthy animals. So anyway, this is not strange, because with PCV2 it happens exactly the same. However, probably under certain circumstances might be could cause disease. But anyway, PCV4, which has been detected so far only in Asia, I don't have any exclusive, but might be soon we will see that PCV4 has been detected also out from Asia. But this is in the next few months, I believe. And PCV3 is different, because PCV3 is widespread all over the world, and our way of thinking nowadays is that PCV3 is able to cause disease, and even not only at the reproductive stage, but also in the postnatal phase. The only problem here is that we do not really know which are the circumstances by which this virus is able to cause disease. And this implies that we do not really know which is the real impact. Might be has more impact than we think. However, it's difficult to demonstrate. That's a major problem.
Well, definitely we'll keep an eye on it for sure.
Absolutely. I believe we need it.
For sure. So changing to a broader topic and related to something that you said before. So in 2020, you and Julia Vergara, both from CReSA research, joined the World Health Organization R&D Blueprint Team for Priority of Disease. As you said, the World Health Organization has a working group of animal models of COVID-19. 2021, you were included in the Scientific Advisory Committee of the COVID-19 in the Catalan government. And it seems someone has finally realized that veterinarians have something to say in the control and monitoring of pandemics, as the model that I believe the COVID pandemic assumed is pretty similar to what animals do. So is that true that most of the pandemics or new infections are zoonotics, and why is this?
Yeah, no, this is absolutely true, in the sense that nowadays we know that 60% of the human diseases are of zoonotic origin. And from an emerging infectious disease of humans, 75% are of animal origin. And if you are thinking in something which is out from this scope of this interview, bioterrorism pathogens, 80% of them are of zoonotic origin. So this means that the interplay between people, animals, and not thinking just on domestic animals, especially in wild animals, it's very, very important. And I would say that in the last few decades, this kind of interplay has been intensified, in the sense that civilization has been addressed towards the wildlife. And this has, to a certain level, to make much easier potential contacts with different pathogens, with different animal species, etc. So it's very likely that at the very end, most of us, we are mammals, even we have some pathogens affecting other species which are not mammals that can infect people, and the avian flu is a very good example of that, for example. But at the very end, it's not surprising that at least a huge percentage of pathogens, viruses and bacteria are able to infect both humans and animals.
So basically what we're saying is that what we normally address as the One Health concept that we already discussed, it's becoming more and more relevant every day. Is that the new scope, the new prisma that we need to look into things?
Absolutely, yes. In fact, the One Health concept could be defined as a kind of interdisciplinary approach in order to counteract or to improve the public health globally. But this implies, of course, to mobilize a number of people, in the sense that One Health is not just a medical issue or just a veterinary issue. It involves, at the very end, many other disciplines that sometimes we are not conscious about that. And this means politicians, this means pharmaceuticals, this means lawyers, this means lots of professions that can be involved really into this concept.
So it would be almost like a multidisciplinary team where we would have everything, right? So what a veterinarian with this background is, with this background and this experience can bring specifically to, for instance, a task force that would be created by medical doctors, veterinary doctors, pharmacists, companies ready and able to produce vaccines if they needed the government. What would be the core skills that a veterinarian could bring to this type of task force?
Well, to my understanding, at least veterinarians, we are in an excellent position to help into this concept. Of course, for example, ecologists are extremely important. People working with climate change are extremely important as well here. But we as veterinarians, we are at least those dealing with production animals, we are dealing with populations. And then to control diseases in sometimes huge populations in a reduced space gives us the possibilities of helping to propose measures that can help in the control of such diseases. In fact, it's amazing because the Spanish community of veterinarians have a special logo which indicates Hygiene pecoris salus populus, which means that the hygiene of the animals is the health of the people. And this is true because it implies rapidly this One Health concept, especially thinking on zoonotic diseases. So if you are able to prevent diseases in the animals, might be you will be able to prevent diseases in human beings as well.
Quite appropriate,
yep.
Indeed. So my next question would be like, okay, One Health integration sounds great, but we are still defining the conceptual framework of what it means, right? And this inevitably will need to be translated into policy. So have we already done this? Are we working on this?
I believe that we have never ever been so advanced into the concept. However, probably this is not enough. That's for sure. What happened here? For example, here in Spain, it has been created what it has been named as the One Health platform. And this One Health platform tried to, to push a little bit towards the different disciplines that can be involved in terms of bringing the abstract idea into reality. And this is the difficult part because, of course, if you want to design policies, programs, research regarding any One Health, you need, of course, money, you need resources, you need people, you need a number of issues that sometimes is difficult to justify, especially when the pandemic is over. Even it's not over, but anyway, the perception that as a population that COVID-19 is not with us anymore. Yeah. Even this is not true. But anyway, of course, the need that you believe in making the efforts for going for that direction is probably not as clear as 2 years ago, for example. In fact, it's also incredible because just in 2020, the World Organization for Animal Health published some data which is not completely rounded in the sense that probably there are a number of issues that can be discussed about that. But they said that in order to prevent new pandemics, we should invest globally, at the worldwide level, around 18 to 27 billions of US dollars per year during 10 years. Understood the billion as the American billion, not as the European one. But anyway, this looks huge in terms of money. But when you are summing up those amounts, it represents less than 1% of what costed the pandemic to the world. So from this point of view, the investment has to be proactive in the sense that you have to anticipate the problems, not wait and then be reactive. Because when you are reactive, the economical cost is extremely huge. And for example, in the One Health concept, economists have a very important role there as well.
And talking about economy, money, and power, what would you say it is the balance between, bringing these policies to life? They sit with the likes of the governments level or with the specialists. I know it's always a negotiation and always someone needs to pay the bill, right?
Absolutely.
But how do you see this balance? How is the conversation going?
Well, one of the things that really worries me is the fact that when you have a problem in situ, everybody's talking about that and everybody has the willingness to help and even to design such policies. When the problem is over or almost over, to move things around is much more difficult. However, I believe that we have successful stories already because the creation of this One Health platform, and there's a number of countries in which similar platforms have been created, is a good, let's say, a step forward. But also the collaboration, for example, between medical doctors and veterinarians, at least I can talk by myself, but before 2020, I had never had the opportunity to work with medical doctors. And since then, because of SARS-CoV-2, we have been collaborating, and even nowadays we are still collaborating and having projects all together. It's a real pleasure to work with them, and we can learn from each other. So from this point of view, I believe that might be small initiatives are the ones that can help pushing the whole system for going to that direction. However, of course, we need much more than that. This is not enough.
And what about all of us? So the general public, are we doing some efforts to communicate this to the general public? Is the general public aware? What's happening at the level?
Well, I'm pretty sure that the wording One Health has been discovered by most of the citizenship because of the pandemic. However, for the citizenship, especially when dealing with those technical terms, it's very easy to forget them. And of course, if you do not hear about that in a very systematic way, you don't care. So one of the important points to my understanding is that the One Health concept is so important that it should be embedded the society at the education level. So what happened with our little kids? Our little kids, they know about animals, they know about medical doctors, they know that they are veterinarians, but we never teach in the sense that everything is connected, that certain actions, especially in regards to the ecosystems, might be are not good enough, that we have to preserve the environment and things like that. And I believe that this should start with kids of few years of age, and then why not, especially in the high school, in the secondary school, and especially as well in during the careers of at the university. Why not to have One Health as a subject? For example, there's many careers that would be of benefit of having this kind of subject. But we have to start education from the very beginning. You cannot start, let's say, teaching those things in guys with more than 30-year-old because they will forget immediately. But if you start with the 3-year-old ones, might be those will retain the concept for the future, which is important.
Wow, it looks like we have still, a long walk to go, but I like your suggestion. I fully agree with it. So really interesting. So Kim, I think this was an amazing time. I really enjoyed talking with you. You came across really passionate about what you do, and even bringing subjects that unexpected that really interconnect to what we're talking about. No, thank you for sharing your kindness and your wisdom with us, and it's really been a great honor to be able to interview you. By the way, we recorded a series of tutorials on necropsy of the pig with you, as you know, and they are fantastic, and we were talking about them just we started the interview. I think they are one of the most seen videos on our channel in YouTube. So, congratulations on that. I don't think it qualifies for huge follower on TikTok or something, but definitely, for the people that are interested, pretty sure a lot of your students around the world, it's amazing. So thank you for your collaboration and thank you for this interview.
No, thank you very much. My real pleasure, Alex. Pleasure to be here.
Thank you. Take care.